The third trimester is a critical phase in pregnancy, marked by anticipation and excitement as the due date approaches. However, it's also essential to stay vigilant for warning signs that may indicate potential complications. Here are some key symptoms to watch for and promptly address with your healthcare provider. 1. Decreased fetal movement. Fetal movement is an important indicator of your baby's well-being. Typically, you should feel your baby move several times a day. A sudden decrease or change in the pattern of movement could signal distress. If you notice a significant reduction in movement, try drinking something cold or eating a small snack, then lie on your side and monitor the baby's movements. If there are fewer than 10 movements in 2 hours, contact your healthcare provider immediately. 2. Severe swelling. While mild swelling of the feet and ankles is common during pregnancy, sudden or severe swelling of the hands, face, or legs can be a warning sign of preeclampsia. Preeclampsia is a serious condition characterized by high blood pressure and protein in the urine, which can pose risk to both mother and baby. If you experience severe swelling, especially if accompanied by other symptoms like headaches or vision changes, seek medical attention promptly. 3. Persistent headaches. Occasional headaches can occur during pregnancy due to hormonal changes and increased blood volume. However, persistent or severe headaches that do not respond to usual remedies like rest or hydration may indicate a more serious issue. Coupled with other symptoms like high blood pressure, these headaches require immediate evaluation by a healthcare professional. 4. Blurred vision or seeing spots. Experiencing blurred vision, seeing spots, or flashes of light can signal preeclampsia or other neurological issues. Any sudden changes in vision should be reported to your healthcare provider without delay. 5. Shortness of breath or chest pain. While some breathlessness is expected as the growing uterus presses against the diaphragm, sudden or severe shortness of breath, chest pain, or a rapid heartbeat could signal a more serious issue such as a blood clot or heart problem. These symptoms should be treated as medical emergencies. 6. Bleeding. Any amount of bleeding in the third trimester should be reported to your healthcare provider. While light spotting can sometimes be normal, especially after a cervical exam, heavy bleeding or bleeding accompanied by pain can indicate placental abruption, placenta previa, or preterm labor, and requires urgent care. 7. Severe abdominal pain. Severe or persistent abdominal pain is not typical in the third trimester and can indicate serious conditions like placental abruption, preterm labor, or uterine rupture. If you experience intense pain that doesn't subside, contact your healthcare provider immediately. 8. Preterm labor symptoms. Signs of preterm labor include regular contractions before 37 weeks, lower back pain, pelvic pressure, and a change in discharge. If you suspect you are in preterm labor, contact your healthcare provider right away to discuss your symptoms and potentially receive treatment to delay labor. 9. Leakage of fluid. A sudden gush or steady trickle of fluid from the vagina may indicate that your water has broken. This is a sign that labor could be starting, even if you are not experiencing contractions. It's important to contact your healthcare provider to confirm and receive guidance on the next steps. 10. High fever. A fever over 100.4 degrees Fahrenheit without an obvious cause can indicate an infection that might affect both mother and baby. Seek medical advice to identify and treat the underlying issue. 11. Itching, particularly on hands and feet. Severe itching, especially on the hands and feet, can be a sign of cholestasis of pregnancy, a liver condition that affects the flow of bile. Cholestasis can increase the risk of preterm birth and fetal distress. If you experience intense itching, notify your healthcare provider for appropriate testing and management. 12. Unusual or severe leg pain. Leg cramps are common in pregnancy, but severe or persistent leg pain, particularly if accompanied by redness or swelling, could indicate a deep vein thrombosis, a type of blood clot. DVT is a serious condition that requires immediate medical attention to prevent complications. Subscribe our channel for more pregnancy and parenting videos.